Hi, I'm Dr. Siddharth Unithan. Welcome to Sportsman Doctor. I know it's been some time since I've done an injury reaction, so I thought that I'll do something on cricket because it's the IPL season going on. So I thought I'll talk about the Kane Williamson injury. So let's get into the injury. So Kane Williamson, as you know, is New Zealand cricketer, and he was playing for the Gujarat Titans in the IPL when this injury occurred. So what happened is that there's a match between the CSK Chennai Super Kings versus the Gujarat Titans, where CSK Gaikwad is batting while bowling was from the Gujarat Titans end, and he hit a long shot into the deep square boundary, and it was almost going for a sure six. While Kane Williamson was fielding at the boundary, he jumped for the ball and caught it and landed on one single leg. So if you've seen the video, you'll be seeing the video in which he's actually landing on a single leg, and the whole impact of his body comes onto the knee. Now what happens is that immediately he collapses and he clutches his knee. He knows that something has gone wrong. So let's get into what exactly happened. So as you know, ACL is basically a ligament in the knee. So our knee has multiple ligaments. So as he jumped, he lands onto the ground. He twists. There's a twisting nature because he's rotating as well. While he's catching the ball, he's rotating. You can see that, and he lands with full force onto the knee. Now what happens is that this makes too much load for the knee, and it collapses and it causes a tear of the ACL. So an MRI, he was immediately shifted, and I think they took an MRI and they found out that he had a complete ACL tear, which makes him ruled out for the competition. Now what is an ACL? ACL is basically an anterior cruciate ligament tear. So you must have heard of an ACL because multiple footballers do get this injury. It's quite common in footballers, but in cricket it's not that common compared to a footballer. So what exactly happens, what is exactly ACL is that we have four major ligaments in our knee. It's called the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral, and the lateral collaterals. Four ligaments. Now, if you think the knee as a house wall, and the main center of the knee is the room. So you've got in the front the ACL, the back you have got the PCL, the side rooms you have got the MCL and the LCL. So it's like four walls, you can say, out of which the front wall has collapsed now. Now what happens in this case is that this ligament is very important for rotation and preventing it to fall forward. So when you are going to do a rotatory movement, this ligament holds on and it prevents it from moving forward. So what happens is that when you're walking straight, you might not have an issue. A normal person who's walking straight with an ACL tear won't have an issue. But if he does a sudden rotatory movement, he will suddenly collapse, he'll feel unstable. So that is when they say that something is giving way. And this is the major symptom for an ACL. So if you ask an ACL person, he won't say while he's walking straight or while he's climbing steps. He will say that while he's going down, he is finding it difficult. So descending stairs is a very common symptom for descending stairs. When he get pain or discomfort, that is a very common symptom for an ACL injury. So that's how you can easily, with symptoms itself, you can diagnose whether he has an ACL injury. Now, what else can happen with an ACL? Other ligaments can be involved also. Unfortunately, I don't know exactly what his MRI findings are, but I do know that there is an ACL tear. There could be also other ligaments injured. Usually the LCL gets involved, or the PCL might also get involved if it's a major such injuries where the load is very heavy. A meniscus. So meniscus are basically cushion-like items which are between the two knees. It is basically like a shock absorber. So that can get torn also. And that causes severe pain. Whenever you do any loading movement, it causes compression on the meniscus, which can cause pain. Now, the treatment for this. Now, when there is a complete tear and you are an athlete, usually we go for surgery. It's almost 100% better to go for a surgery, because what happens is that their stress is much higher, and there is always a chance for OA to occur in the long term, and he has to load his knee in different direction. He has to move while fielding. So it would be better to always to go for a surgery. And in this cases, we would advise him to go for surgery. Now, what surgery is usually done here? In here, mostly an arthroscopic ACL reconstruction is done. So what is arthroscopy? You would have heard of the term keyhole. So where they don't open the whole knee up. They take small puncture holes are created, and they view directly through a small tube, and they see what is torn. They take a small part of the muscle and fix it as part of the ligament. That is all done through this keyhole. So what happens is that you have small suture holes. So what happens is that the admission time, the hospital stay time, everything reduces, and the chances for infection, everything comes down quite significantly. Now you start the immediate rehab very quickly. Now how the rehab happens? So in rehab, immediately from the first day, you will start rehabbing, you will start strengthening, you will start moving your knee, you will try to start bending the knee, and you'll start loading the knee. And usually by 2 to 3 months, you should be completely bending your knee fully. And then after 3 months, you will be starting on other knee exercises, which is much more heavier instead. Usually by 3 months, you will be able to do your normal activity, theoretically. But after 3 months, you will have to start strengthening for you to return to game. So that is where the rest 3 months. So total, it takes around 6 months for you to come back towards a normal stage. But to get to play at a very heavy level, at a very high level, it takes much more time. And this is individualized based on person to person. And that is where sportsmen and doctors come into being. Where we work with the athlete, we will be working with the physio, with the nutritionist, with the psychologist, because it's a combined effort where we will get you back as quickly as possible into the ground or into whatever activity you want. And that is where ACL, reconstruction, where we work along with the orthopedic surgeon also. So orthopedic surgeon, the sports medicine physician, the physio, the nutritionist, the psychologist, all of us come together and work together. Why psychologists, you must be thinking also? Because psychologists, see, you have got a major injury on your knee and you have to be motivated to come back to play. Whether you will be able to come back to play, you will be, or sometimes some days is very down, you need to push yourself. That's where the psychologist helps also, to push them, to motivate them, to get them much more faster and quicker. Because only a nutrition, just only with food or just only with strength training, it's not possible. You have to do everything. Now the most important part, which is usually missed in an ACL injury, is basically return to play. What happens is that in return to play, most of the people, once they get back to somewhat normal stage, they think that everything is all right. Okay, let's wait till 6 months, and then from 6 months onwards, I'll go and start playing. And usually what happens, you start getting pain back, you start finding it difficult, and you'll start blaming the surgeon, poor surgeon, for saying that the surgery did not go well. But actually what would have happened is that you have not done your rehab properly. So this is where you have to work with a sports medicine doctor, or you have to work mainly with the physio and the strength and conditioning trainer. But usually with the supervision of sports medicine doctor, what we can do is that we can accelerate your speed of return to play much more faster. We can get you back into activity as to how the stepwise procedure to get back into activity. And now for this Kane Williamson injury, definitely he'll be working with a sports medicine physician. That's why he's gone back, I think, to New Zealand or for surgery and for rehab and everything, where he'll be working together with a team to get him back to normal as quickly as possible. So but because of this, he would get injuries, this thing. So if you like this video and if you want more about, I can do a pure ACL, a topic on ACL reconstruction and ACL, what is the reconstruction done, or whether an ACL repair is done, what is an ACL repair, what is an ACL reconstruction, what is meniscectomy, what does meniscal repair is being done, how do we go about the rehab process, what is the first week done, what is the second week, third week, fourth week. If you want such videos, we can do that also. That will be much more interesting for me also as a perspective to give. You have to understand, this is very individualized. Even though there is a common protocol, this is not for a single person, the formula fits everybody. No, it doesn't work like that. It depends on each person, because your pain is completely different to what my pain will be. Your loading nature will be completely different. Your activity level will be much different to a normal person. So this is where we work together with the sports medicine doctor to to build up you based on your level, your requirement and your need. You understand? Hopefully, I hope you have understood the video. I hope I didn't bore you too much with these explanations. Thank you for watching this video. I'll be trying to do such videos more often. Thank you once again for watching. See you till next time. Bye.